Thank you so much, Dr. Battinelli, and once again to the entire Northwell team. As you can see, this is a huge effort across the entire system, inspired by Michael Dowling. But really, I'm reflecting back when we started this forum in 2019. This is the 6th one. And at that time, we as an institution, this was not ingrained into our culture. Right? Gun violence prevention was not something that most physicians at Northwell knew what to do about. And now fast forward, right, to our 6th forum, it has become a huge part of our system. We've screened nearly 200,000 patients. We lead over 110 different initiatives in the New York area, and that is really a testament to the whole entire health system. So thank you all for being a big part of that journey. Over the next 35 minutes, we're going to speak to some inspirational healthcare leaders and healthcare CEOs who have really been at the forefront, along with Michael Dowling, of leading these efforts. And we're going to hear from an incredible survivor advocate who wanted to come on stage today by her own accord to inspire and to move folks to action. So before we dive into our panel, just a quick brief update. So as you know, in 2022, Michael Dowling, along with a number of other healthcare CEOs nationally, formed the CEO Council for Gun Violence Prevention. This was the first C-suite level council focused on understanding how health systems can actually integrate gun violence prevention work into their strategic plan. I was surprised in 2019 how few hospitals actually had a public health approach to gun violence prevention. They prioritized cancer prevention, heart disease prevention, but this was rarely an issue that was talked about. Now, fast forward, over 60 health systems have joined this council, and it's been incredible to see movement. A big shout out to all the representatives from the health systems who we collectively have been working with over the last year to move forward a number of agenda items, including the public awareness campaign that you saw earlier. We have worked to develop blueprints for how to implement gun violence work within hospitals. And we have a workplace safety group that is focused on actually developing an action-oriented guide for health systems on how to address workplace safety. So we are really, along with many of the co-leads in this group, I do want to give them a big shout out because they are the reason why, along with the CEOs, a lot of this movement has happened. So, let's pivot. We have incredible healthcare leaders here. We have Wright Lassiter III, the CEO of CommonSpirit, massive, massive health system. We have Matt Cook, the CEO and president of the Children's Hospital Association. And then we have JP Gallagher, the CEO of Endeavor Health. Really, it's an honor to have you guys here today. We're going to kick off, we only have about 15 to 20 minutes, right? So we don't have that much time, but I want to get to the kind of meat of the issue here. Let's start right with you. What brought you to be passionate about this topic of gun violence prevention and prioritizing it for your system?
Well, first, thanks for having me, and it's great to be with all of you that are doing this work. And I think like a lot of us who sit in CEO chairs, we should acknowledge that most things don't start with us. Most things weren't our idea. And so in this case, for my organization, I would say that the focus on gun violence prevention for CommonSpirit was absolutely not my idea. It actually began about 15 years ago, even before we were CommonSpirit. But I think about, as I listened to some of the earlier speakers, and I reflected just a little bit on my career. I've worked in healthcare in Dallas-Fort Worth, in Oakland, California, in Detroit, Michigan, and now an organization that spans a couple dozen states. And I think about in each of those times in my career when I was focused on an organization that was more locally focused, prevention and violence prevention was a key initiative. Whether it was Dallas or whether it was Oakland or whether it was Detroit, is a big issue. And so in our organization, it really began because we acknowledged that back when we were Dignity Health in 2009, recognized that the communities that we were serving at that time in California and Arizona and Nevada had significant issues where people were coming in and out of our emergency rooms, victims of violence first, gun violence very significantly, and that we had an obligation to try to figure it out. Today what I would say is this, our vision at CommonSpirit is a healthier future for all. And we think about the communities that you all serve, that we all serve. Those communities will be healthier when we prevent violence in its broadest in its broadest manner, and specifically this. For us, we treat tens of thousands of victims of accidental harm from gun violence a year. And our data says that nearly 70% of those are preventable. And so we have an obligation to find a way to collaborate with the communities we serve to solve this problem.
Mm-hmm. Well said. Thank you. Thank you for sharing that. Matt?
Yeah, it's a great question. Prior to being in this role as CEO of the Children's Hospital Association, I was running children's hospitals in the Bay Area and in Indianapolis. And certainly it was eye-opening to see the amount of patients that came into the ED, a victim of violence, and in particular, gunshot wounds. And I remember in Indianapolis, for example, the hospital was not always a level 1 trauma center and converted over to a level 1 trauma center. And I think everybody was surprised by the amount of penetrating trauma that came in. Mm-hmm. I think the expectation initially was it's going to be a lot of blunt trauma. Mm-hmm. And people were surprised by the sheer amount of penetrating trauma. And certainly in the Bay Area and Oakland, as part of the screening process, we're asking our patients, our children, how many times do you hear gunshots? And the fact that we have to ask that question is part of our routine patient screen is incredibly disturbing. And so as I step into this role as a former hospital CEO, I bring those experiences with me, and I'm part of an organization that represents over 200 children's hospitals. But those children's hospitals serve children don't vote. And so we are their voice, we're their advocate. And if we can't stand up and be their advocate on the issue that is the number one reason why they lose their lives, then I'm not sure what our role is, right? I mean, we've heard a lot about courage today. And if we don't have the courage to have a voice on the leading cause of death, then I would question our value as an association. And so that's how I view it.
And just before I transition, can I just get a little bit more detail on that? So as an association, how did you transcend some of those barriers? Because you obviously serve a number of different constituents.
Yeah, it's a good question. So we have hospitals that span both ends of the political spectrum. We have hospitals in deep blue states, purple states, red states. And as a member organization, when we were contemplating signing on to this initiative in the Ad Council, and we're one of 2 associations that have done that. So thank you to my colleagues at the American Medical Association for also doing that. I was having a conversation with my board about this, and I said, look, let me take the heat for the issues and the topics that you can't take the heat for. I was like, that's my job. I run an organization where I can take the heat, so let me do that. And that was sort of a pivotal moment, I think, when realized, I can, as the CEO of the association, I can be out there, out front, talking about those issues that are important for our members, but are also important for children. And the two are intertwined, but it's back to what I was just saying. I mean, I have to have the courage to take on those issues that are of importance to children, that are difficult, inconvenient politically, uncomfortable. That's too bad. That's my role, and I believe in that. I believe in the mission of what we do.
Wow. Thank you for sharing that. I mean, all too often it's flipped. It's the other way around, and I think that's a really nice way to frame it. And a big shout out to the medical associations that have been so supportive of this work that are in the room. JP, I know you have a lot of personal experience, right, of why this issue is important to you. Can you share?
Absolutely. First, I just want to say, though, I'm pleased to be here and very relieved. I almost wore the exact same shoes as Wright.
Oh, that's right.
He and I get mixed up all the time. So I'm going to try to separate myself. Okay, so sorry, I digress. So we were at dinner last night, and there were a number of people who shared some very humbling and powerful stories, some of which have been shared on panels. And so what I shared with that group was, so when I was 22 years old, my brother-in-law committed suicide with a gun. And as has been told in other stories, that scar tissue is still very much a part of our family. It was a devastating experience. It was not one that I think we really saw coming. In hindsight, mental health, substance abuse, certainly variables. Later that year, I had just moved to Washington, D.C. for my first job. And I got a call sort of in the middle of the night. A good friend of mine from college was in a panic because her roommate and another good friend of mine, a mutual friend from college, had just been shot in the parking lot of their apartment complex in a carjacking. And so I ran over, lived about a mile away. Mary had been taken to the hospital and was declared dead about an hour later. So I ended up being kind of the bridge with her family as they sort of pieced that together. And all I'll say is at a relatively young age, I sort of had this awareness of an issue that, growing up in suburban Minneapolis was not part of my experience. I would say that maybe a silver lining in that was it did steer me in terms of wanting to get into nonprofit healthcare. And then fast forward, when I made my way to Chicago, I spent several years at a major trauma center on the south side of Chicago, and that was an eye-opening and powerful experience. And then I guess organizationally, so now as the CEO of Endeavor Health, we're a 9-hospital system. We take care of about 1.5 million patients across the Chicagoland area. 2 summers ago, 4th of July 2022, 4th of July parade in downtown Highland Park, a young man in that community got up on a rooftop with 2 assault rifles and just opened fire on 5,000 individuals. That parade takes place a mile from our Highland Park Hospital. And so we had doctors and nurses who were, parade goers. We had children of our team members who were in the parade. And we turned that community hospital into a level 1 trauma center for the next 10 hours. We saved a number of lives, but we lost 7. And we had 50 gunshot victims. And again, that experience is part of our community. It is part of our organization, and it triggered a conversation around, as has been said in other ways, what are we going to do about this? And so when you're in a position to sort of mobilize, to raise attention and put resources, that was an easy answer to make. Part of our organization, we aspire to be a very strong community-connected health system. Our mission and purpose is to essentially advance the health and well-being of our communities and make them better. And so one of the things we got right early on was we set aside $200 million in a community investment fund. And as has been shared earlier, a lot of it comes down to partnerships. We realized we couldn't affect the kind of change we believed was needed for that mission without other respected partners in these communities. And so whether it's workforce development, violence prevention, behavioral health, homelessness, food insecurity, we have tried to embed ourselves in a variety of initiatives that have change at a very local level. And that's been very gratifying. We put more money into that than we have into our new Endeavor Health brand. And it has opened up dialogues. It has created trust. It has allowed us to move the needle in some very meaningful ways. And not surprisingly, with our 27,000 team members, it's been incredibly motivating.
Wow. And does that fund operate like a fund, or?
Yeah, so we set it up in perpetuity. I mean, we're 3 years into it. We've invested actively about $30 million in about 46 partnerships. So these are substantive grants. These aren't, $10,000. They're anchored very intentionally in specific needs and specific communities. So it varies. Swedish Hospital, Safety Net Hospital in the city, their needs are very different than Edward Hospitals in Naperville. So whether it's suicide or violence prevention, or it's getting youth into our facilities for internships that create job paths, it takes a variety of shapes, but they tend to be pretty deep, long-standing relationships that have runway. And so, it's early in the journey, but I'd say it's been incredibly powerful.
It's amazing. Yeah, one thing. Yeah, go ahead, Wright.
I want to just highlight two quick points that my colleagues have shared here. First, Matt shared around courage, which I think that at this moment in time, it's critical for us as leaders to sum up the courage that's necessary to stay true to our values in the face of, we heard earlier today about tailwinds and headwinds. I think it was a nice way of describing it. I don't know if Michael's in the room or not. But I think that courage is something that we should all really be summoning up as much as possible. And then the second thing, I'll just let share a story, which is JP talked about partnerships and collaboration. And we have two partnerships that I just love to just describe very quickly. I know we have very little time. One, some of you will be surprised by when I talk about gun safety. In Lexington, Kentucky, our most successful partnership is with the NRA. And you might say, what was he smoking when he smoking something when he bought the shoes and when he told the story about the NRA? Well, so the short answer is, we realize when we think about partnerships that in that community had a lot of trust in NRA, and we had a problem. The problem was we had a lot of kids who need to be educated on guns, and a lot of parents that need to be educated on how to safely store the guns that they had. And the NRA was willing, not initially, but was willing after some conversation to partner with us on a community education program so that kids now understand what to do and what not to do when it comes to education. The second quick partnership I would share with you is we have what we call a shareholder advocacy program, and not unlike, a little different than what JP described, but where we purposefully invest in public companies that some of you might frown if you'd say, oh, CommonSpirit, the largest Catholic healthcare system in the United States, invests in. So we purposefully invest in Sturm and Ruger. You might say, what the heck is that? It's one of the largest gun manufacturing companies in America. And you might say, well, why do we do that? We do that for the sole reason to be able to sit down with them as a shareholder and say, as a shareholder, we believe you should do X. And we're even willing to go forward with a shareholder resolution at your annual meeting if you stonewall us or aren't willing to talk to us about what X is. And they've done some things, they've agreed to do some things that you might not expect a gun manufacturer to be willing to do because they listen to those points of views, and we've actually gotten 2 resolutions passed with more than 70% of shareholder approval of things that we think will really help when it comes to gun safety. And so I would just say that we should always really be focused on, there are a lot of non-traditional partners that are out there that can help us when you're focused on an issue that, as we heard earlier, 80% of Americans agree on. So.
Yeah. It's amazing. And I think what we're hearing here is there are such different ways to approach this issue, right? It depends what type of firearm injuries you're dealing with in the communities you serve. Wright, you have hospitals across the country. So I'm sure there are different considerations in different places. And one story that really sticks with us, I think many in the room, and a lot of the folks here have kind of informed that story, is, we had a 12-year-old girl who was shot in the chest, unfortunately passed away. This was a couple years ago. And that 12-year-old's brother was 14. And he told us right off the bat that he lived a life of hopelessness. He had nothing to look forward to. None of his friends had any hope. Simply by coming into the hospital, shadowing surgeons, nurses, administrators, he is now accepted to nursing school and brought 4 friends with him.
Awesome. That's great.
And for the first time in their families, right? And because we commonly hear, what can I do as a healthcare worker?
Possible?
Yeah, what's possible? And I think you guys are very much highlighting that there are different ways to approach this. Matt, I know the CHA, and we have 1 minute left, but you've done such incredible work. So if you can summarize the last 10 years of work.
So, as you said, hospitals approach this differently. So we're actually releasing a report today. We have been working with 38 of our member hospitals to understand how they're approaching this issue themselves in their communities. And one of the things that CHA does well is we convene our members well, figure out what best practice is, and then disseminate the best practice. And so we're releasing this report today. I think one of the issues we have, and this has been discussed, is the funding for research has been uneven over the last couple of decades. And so it's really important for us to figure out a different approach to understanding what best practice is and then disseminating that. And for CHA, today marks an important day of releasing a compilation of what 38 of our member hospitals are doing, how they're approaching this, and what their results are.
Incredible. Well, thank you so much. I think my mic got cut off, but
That sounds good.
There's the hook. It's like the hook.
thank you so much. I know we could talk for hours, but I appreciate
Thank you.
it.